Hello, I'm Dr. Kyle Murray here with AtlasBrainSpine.com, and I have a message for college students who are interested in pre-med, biology, kinesiology, exercise science, or any other science majors. These are people who are, in general, looking for a career within the healthcare field. And I hope that this video offers some insight and some key potential takeaways for your future that you may not have even considered. To give you some key insights on what you can do with actually that science background that you're studying currently, one of those big careers is actually chiropractic. And that was something that was completely off my radar as I was going through school, but it quickly became my passion. And so I want to walk you through why that was. My journey starts in high school. So I had 6 concussions playing lacrosse, and that left me migraines for years. After going through the entire medical process and going to neurologists, MDs, getting MRIs done in my brain, I was left with just being prescribed pain pills. I was 16, I didn't want to take painkillers the rest of my life. I knew something was going on. So a family friend actually recommended a chiropractor. Within a week of adjustments, my migraines were gone. 3 years, gone. Which was incredible, something I didn't know was possible. Now, going into college, I studied biology and specifically an emphasis on biomedical sciences. My career and my pathway was going towards medical school. So within my cohort, I was the only one that actually at the end of it became a chiropractor. And the reason I shifted to becoming a chiropractor versus a medical doctor was I went and shadowed 2 medical doctors and 2 chiropractors outside of the chiropractor that I've been seeing. I asked them each the same question: if they could go back in time and redo their schooling, would you? And all the medical doctors said no, and all the chiropractors said yes. That's huge in my book. So one quick piece of advice then that I learned from asking those questions was the actual job satisfaction. And are you happy with what you're doing? Clearly the chiropractors who are willing to go back through school to become the same position that they're at, they have immense job satisfaction. But the medical doctors that I was visiting, they didn't want to go through it again. So that was a very clear decision for myself, and I encourage you to go in shadow and do what you need to do to make that decision clear for yourself. So now that we know that, let's take a quick comparison of what chiropractic school looks like and what medical school looks like. In terms of the class hours, the grand total of this is 4,485 hours within chiropractic school and 4,248 hours within medical school. Now, each of course has their core curriculum, which are very similar. Chiropractic school emphasizes the palpation and adjusting techniques, as well as orthopedic exams that are more suited for their field. While within the medical school's curriculum, they have more hours that are focused on pharmacology, immunology, general surgery, as well as other basic necessities for that field. Now within chiropractic school, we have 4 board exams. There's an ethics and jurisprudence exam, as well as a physical therapy exam. And then depending on the state that you go to, you're gonna have a state licensing exam as well. You need to pass each of those tests to become a licensed chiropractor. Now I want to touch on the freedom aspect within chiropractic. There are hundreds of different techniques within chiropractic. If you want to do a full force technique, if you want to do a very gentle technique, if you want to be working on extremities, if you want to work on sports athletes, if you want to do upper cervical work, there's so many possibilities. Additionally, you're not limited to insurance. You can actually be just cash-based, so you don't have to deal with insurance at all. So that means that you don't have any handicaps on you. You can charge what you want to charge, what you think you're worth. So you can also become your own boss. I'm actually an owner of a practice at 27. Think of that. You can be 27 years old and owning your own practice, setting your own hours, being your own boss, and seeing the people that you want to see, all within that frame of reference. Now I just want to leave you with these questions. How do you want to help people? This will determine how you practice. So if you want to be hands-on with the patient, if you want to be there and actually feeling their spine or laying hands on people, that's completely different than general surgery or prescribing medications. The next question I have for you is, why are you pursuing the path that you are? Are you going to medical school because that's just the traditional route? Or do you have a firm aim and a pursuit that you're trying to go for? And if you haven't answered that, fantastic. That's your why. You need to know your why because that's going to strengthen you during hard times. And when you're in practice, there's going to be a lot of hard times. It's truly remarkable what you accomplish within the chiropractic field. It opens so many possibilities that you didn't know existed, and to share that with you. I hope you gained some key insights from this video. And once again, this is Dr. Kyle here with AtlasBrainSpine.com. You found this video to be educational and helpful to make a crucial decision in your life. Please like this video and subscribe to our channel to get more of this type of information and to get it to people who need it. In addition, please ring that little notification bell so that you can be notified on when our next video comes out. If you have any questions or any thoughts, please drop them in the comments below and I'll get back to you. When you begin to heal your brain, you will truly begin to heal your pain. God bless you, and we'll see you in the next video.